Besides using weight training alone, stretching is an effective way to improve flexibility. The range of motion of a joint can be enhanced by stretching the soft tissue surrounding it. And by soft tissue, I mean muscles, tendons, and ligaments. The soreness you can experience post-workout can also be greatly reduced by stretching. Stretching exercises can be performed in 3 different ways, and I'm going to show you the difference between those 3 basic techniques. First, we have static stretching, which is the most common. Static stretching is slow and constant, with the end position being held for 10 to 30 seconds. By holding longer than 10 seconds, it allows your muscle spindles to relax and be less sensitive. Stretching statically should be done to the point of mild discomfort, where a pull is felt, but not to the point of pain. Never bounce while stretching because it increases the risk of injury. After holding the stretch, slowly return to the starting position for 30 to 60 seconds before repeating. Now it's up to you whether you want to do the stretches using a passive or active approach. Passive is the use of an outside force. The force can be done by a training partner, an outside object, or even yourself, like so. Stretching the rear delts, pull your arm across your body, pull slightly on your elbow to mild discomfort once again, don't go too far. Hold for 10 to 30 seconds to make it actually count, then rest for 30 to 60 seconds. Active stretching is utilizing the contraction of an opposing muscle group. For instance, if you want to stretch your biceps, you need to contract your triceps down the bottom. And if you want to stretch your quadricep, flex your hamstring, pull up on your hamstring. That's your opposing muscle. Ballistic stretching is where you often see someone incorporating a bouncing motion to the end of the stretch. This is not recommended, however, because it greatly increases your risk of injury. Not recommended at all. The third and final stretch we're going to show you today is PNF, which stands for proprioceptive neuromuscular facilitation. Yes, it's a mouthful, but I recommend doing it. PNF stretching techniques require a muscle to be contracted before it's stretched. It usually requires a partner and takes more time than static stretching. It also requires more expertise because it involves both passive and active movements. While lying on your back, gently move the leg forward. This is called the hold relax technique. Or move your leg forward while your partner resists the movement. This is called the contract relax technique. The isometric or concentric contraction is held for a total of 6 seconds. The person being stretched is then instructed to relax, and the partner moves the leg to the second resistance barrier. A passive stretch is performed here again, this time for 30 seconds. You can contract the antagonistic muscle here, as in active stretching. In this case, you would contract the hip flexors. Okay. The American College of Sports Medicine recommends that you actually exercise and perform these exercises a minimum of 2 to 3 days per week. Remember, before doing your stretching exercises, be sure to do a light 5 to 10 minute cardio warm-up beforehand. This will warm up your connective tissue and prevent muscle and tendon tears or pulls while stretching. Another good time to stretch is right after your workout when your whole body is already warmed up.